Hey everyone, today we're going to break down a specific therapy for bladder cancer. It's a combination of 3 drugs, Carboplatin, Gemcitabine, and Durvalumab. Now this explainer is purely for educational purposes, really just to help you understand the treatment better, and it's all based on materials from Professor Dr. Mustafa Özdoğan.
So, let's start with a situation that might sound pretty familiar. Maybe you or someone you love is dealing with bladder cancer, but the doctors have said that the standard go-to chemotherapy, a drug called Cisplatin, just isn't the right option. If that's you, then you are absolutely in the right place.
All right, let's dive right in. What we're talking about here is a very specific treatment plan, one that's being looked at for a particular group of patients.
So the big question is, who exactly is this treatment for? Well, it all boils down to understanding one key medical term.
And that term is Cisplatin-Ineligible. Okay, so what does that actually mean? In simple terms, it just means that for certain health reasons, the standard drug cisplatin might cause more problems than it solves. This could be because of something like reduced kidney function, maybe some hearing issues you already have, or other big health conditions. And this is exactly why your doctor might bring up an alternative, like the protocol we're talking about today, which swaps out cisplatin for a similar drug called Carboplatin.
Okay, so now that we know who this might be for, let's get into the really interesting part, how these 3 drugs actually work together as a team to fight the cancer.
You can think of this treatment as using 2 different game plans at the same time. On one hand, you've got the chemotherapy. That's the gemcitabine and carboplatin. This is the direct assault, the brute force that goes right after the tumor to weaken it. But then you've got immunotherapy, which is the Durvalumab. This one is smarter, more strategic. It's like it unleashes your body's own security force, your immune system, to get in there and fight the cancer itself. It's a really powerful 1-2 punch.
So here's how that 1-2 punch works, step by step. First, you weaken the enemy. The chemotherapy gets in there and directly damages the cancer cell's DNA. But cancer is sneaky. It can wear a disguise to hide from your immune system. That brings us to step 2, uncloak. Durvalumab basically rips off the cancer's invisibility cloak. It blocks a signal called PD-L1 that the cancer uses to hide. And once that disguise is gone, you get to step 3, attack. Your own body's T cells can finally see the cancer cells for what they are and go on the attack to destroy them.
So let's do a quick roll call of the team. You've got gemcitabine, a chemo drug that stops cancer cells from making new DNA. Then you've got carboplatin, another chemo drug that damages the DNA they already have. And finally, you have Durvalumab, the immunotherapy, which is the one that gets your T cells fired up. See? Each one has a really specific and critical job.
Okay, so what does this whole process actually look like for a patient? From start to finish, let's map out that journey together. The entire treatment path happens around the time of surgery. It kicks off with what's called the neoadjuvant phase. That's just a fancy word for before surgery. In this stage, you'll probably get 4 cycles of all 3 drugs to try and shrink the tumor. Next up is the surgery itself to remove the bladder. And then you enter the adjuvant phase, which means after surgery. Here, you might continue with just the immunotherapy, Durvalumab, for up to a year. The whole point of this last phase is to help prevent the cancer from making a comeback. So what does one of those pre-surgery cycles actually feel like? Well, it's usually a 21-day or 3-week cycle. On day 1, you'll go in and get all 3 drugs, Durvalumab, Carboplatin, and Gemcitabine. A week later, on day 8, you'll pop back in for just a dose of Gemcitabine. And after that, you get a bit of a rest period for the next couple of weeks until the cycle ends on day 21. Then, you gear up to do it all over again.
All right, let's shift gears and talk about something that's on everyone's mind with any kind of treatment, potential side effects. Knowing what to watch for is so important.
The number one thing to remember here is that everybody is different, and everyone's experience will be unique. That's why talking openly with your healthcare team is absolutely essential. They are your partners in this, and they're there to help you manage anything that comes up.
So what kind of things will your team be keeping an eye on? Well, we can group them into a few categories. First, there are the blood-related effects. Things like low platelet counts, which is a really common one with carboplatin, or low white blood cells, or anemia. Then you have the more general stuff that you hear about, like feeling tired, nausea, or not feeling very hungry. And finally, because we're using immunotherapy, there are some unique immune-related things to watch for, like changes in your thyroid, maybe a skin rash. Your team knows exactly what to look for, and more importantly, how to manage it.
Okay, last but definitely not least, there's a really important piece of context about this specific protocol's status that you need to have in your back pocket when you talk with your doctor.
This is a really critical point, so listen close. The officially FDA-approved protocol for this kind of treatment actually uses cisplatin, not the carboplatin we've been talking about. The version with carboplatin is usually considered for patients who can't take cisplatin. Because of that, it's often used in a clinical trial or what's called off-label. Knowing this difference is so key for having a fully informed chat with your medical team about all the possible paths forward.
Look, our goal here today was never to give you medical advice. It was to arm you with clear information, to empower you, so you can walk into your doctor's office and have the best, most productive conversation possible. Understanding your options is the first step, because at the end of the day, it's not just about what a treatment does, but what that treatment makes possible for you and for your life.